Good evening, everyone. Thank you very much for your kind words, Maria. Let me share my screen. I hope you can see that. Not just let me know. And I'll start with my presentation on the assessment of the efficacy of the treatment of fibromyalgia and DAO deficit using DAO enzyme. Let me thank the organization for having invited me once again. First, I go back to this slide from last year where we ask the question. And out of that question, we have a clinical trial and we see the similarity when it comes to the symptoms and the manifestations in fibromyalgia and patients with DAO deficit. As you can see, all the pathways and all the organs that are usually disrupted or show specific symptoms in both disorders are quite similar, especially pain, fatigue, migraine, GI problems, skin problems. And we come to this potential scenario and the relationship between fibromyalgia and histamine intolerance. As part of this study, we've narrowed down the sample. It's actually closely linked to female patients who have fibromyalgia. And by knowing all the mechanisms involved in histamine intolerance that can increase the circulating histamine and also lead to histamine accumulation in individuals, in recent years, we've followed some studies in fibromyalgia as well for the control of these patients through histamine control, such as endogenous histamine control through drugs. And then recently, we've seen these other interventions study that it's diet-based. It would be a low histamine diet for patients with fibromyalgia. Our starting point is similar, but we focus on the use of DAO ingestion through supplements for patients who have fibromyalgia and that have been assessed through genetic test using the 4 SNPs of the AOC1 gene. Then indirectly, we would also like to look into potential treatment for DAO deficiency in all those patients that even if they did not test positive for the genetic test, so they could not be labeled as DAO deficient, still, if they can enjoy some kind of improvement, if there is some damage to the MM and enterocyte, the viruses there, the villi rather, so maybe DAO supplementation can get an improvement for those patients. And as Professor Struck mentioned, we see the relationship with the blocking of the DAO catabolism. So it can be through alcohol use or also through other drugs. And so this population we've chosen, that is women with fibromyalgia, usually they take large amount of drugs. So the increase of DAO metabolism, rather histamine metabolism through DAO supplementation can also be an indirect mechanism for our patients. And so these are the hypotheses for our clinical trial. First, we wanted to see whether the DAO deficit or histamine intolerance could be used as a biomarker or predictive element for fibromyalgia. And with that in mind, Dr. Pereza-Barucha earlier today discussed the results gathered, which shows the prevalence of said genetic alterations and SNPs in around 75% of our sample. So I think it's self-explanatory, very revealing. And then second hypothesis, that this intervention focused about a potential use of DAO enzyme supplementation as a treatment in patients with fibromyalgia. With this second hypothesis, this would be the flow chart. And this is just the starting point. So we thought of a clinical trial that we conduct at the Ruby International Hospital and our clinic. And we try to choose a sample with this inclusion criteria: women 30 to 60 years of age, already diagnosed with fibromyalgia, medically diagnosed, so by a specialized doctor, and not following a low histamine diet and not taking DAO supplementation. And then, of course, no other chronic diseases, as you can read on the slide. So out of over 200 patients, that was the database, 105 were chosen. And it was randomized into 2 groups. And the study was completed by 87 women. This is the design, study design: women, fibromyalgia, 33 to 60 years of age. And at baseline, we genotyped AOC1 gene and all 4 mutations, SNPs, that you can see on screen, and some questionnaires, clinical background, and also body composition. These questionnaires, as discussed last year, and as you know, we do not have a biomarker, so the only way to assess the impact of fibromyalgia is through questionnaires. We might say some are symptom-based and some others specific of the therapeutic or pathophysiological areas of fibromyalgia. We measured FIUK, also pain classification, and a GI symptom score, sleep, insomnia, physical exercise, adherence to Mediterranean diet, before and after intervention, and the Bristol scale for GI movements, intestinal movements. This was 8 weeks after DAO, starting them on DAO. And up there, you can see the design. So it's double-blind with placebo. And so it's quite a robust design for the experiment with humans. And these groups are well balanced because it was 43 for the placebo group and the HIT group was 44. After the genotyping, we saw the level of mutations in their own genotypes. So they were characterized, understanding their genetics. And out of that 75% prevalence, I see well representation and distribution for all groups. The placebo group had 31 individuals and the intervention group 36. So it was quite similar. And here you see the most relevant results of this intervention. It was 8 weeks that we got for the analysis. And this first table is the result of FIQ and the pain catastrophizing scale, PCS. Here you see a column for the placebo group, another one for the what we call the DAO group or the intervention group, and also the interaction analysis. So the baseline would be the first line, and the result in 8 weeks is the second one, and the p-value, that would be statistically significant difference, is the first cell here. You see that there are almost statistically significant differences with full N. And by the way, let me tell you that this has been total patients, which is FP, all the patients recruited before genotyping and then divided into a second group if they already have DAO deficiency in genetic terms, at least one of the mutations. So this has been replicated, as you can see, in both groups. And so for the fibromyalgia impact questionnaire, in both groups, we see statistically significant difference, or almost significant, between the placebo group and the DA group before and after for the full sample. And then as part of every group, when we try and see how they're doing regarding just patients who had DAO deficiency, we see there are statistically significant differences before and after. But if we check out the correlation, the interaction between both groups, there is no statistically significant difference, which probably is due to the fact that in both groups there was an improvement in symptoms, improvement of symptoms as through the FIQ questionnaire. This is quite common in double-blind placebo trials because of the placebo that is included precisely to determine the effect. It suggests the fact that you're part of a clinical trial. That is what I mean. Then we also measure frequency and intensity of symptoms, as we said that we usually find in patients with fibromyalgia or DAO deficit. Specifically, we produced a list of symptoms as we've summarized frequency before the intervention and after completing it in 8 weeks, as well as the symptom intensity, kind of two different measuring parameters. Here you can see frequency of symptom, and then bloating, for example. That's the effect. That's statistically significant differences for the DAO group. Same for pain or acidity, burning sensation, and nausea. And then about intense pain, there's also a difference in the DAO group in the full sample. So, when compared to the other group, so that is against the placebo group, there is statistically significant differences just for nausea and burning sensation. Even though it's been statistically significant before and after, just for the DAO group, that's where we find the statistically significant differences, but not for the placebo group. Still, there might not be statistically significant differences between two groups or comparisons because of the statistic power, but we are trying to go through the data in depth to better understand its meaning. Here you have another table where we show intensity of symptoms, clinical symptoms. As we said before, both variables have been measured separately. And again, statistically significant differences which are relevant for urticaria or itchy skin or other skin problems, abdominal pain, burning, acidity, and reflux. As for intensity, let me say that the placebo group also showed statistically significant difference in the intensity of symptoms. As you can see, differences are similar, and this is one of the potential reasons there might not be differences between both groups, because there's been an improvement in both. As a way of a conclusion, it's true that we've seen a significant association between AOC1 gene and some symptoms of fibromyalgia. Maybe with oral supplementation of DAO enzyme before meals can bring down a number of symptoms that are common in fibromyalgia patients. Especially, statistically significant differences were found for burning, bloating, pain, hives, itching, diarrhea. And we hope we can increase our knowledge so that we can fully understand the results. Undoubtedly, we need more studies to confirm our findings, and by increasing the sample size, we will try and compensate the statistic power that it's probably limited in our intervention. In any case, follow up for longer periods of time. This study will have a follow-up. The intervention is 6 months, and that's where we are now. We're now completing this final endpoint with patients to see the end or the evolution of all those symptoms that we've discussed for the intervention. As I said, 8 weeks, and we're just waiting on the results. And we're excited, and we have high expectations about those because it's novel, and we find it could be a very interesting approach in the future for clinicians and researchers alike. And so this has been all for me. Thank you very much for your attention.